I think for me, there were three take home points from Dr. Flano's presentation. Number one, I'm glad you made a friend and somebody who protects you. Uh, but number two thing, and remind you that in the back we have the fire and rescue from Birmingham, and they have information about radon detectors. Because even though we know about lung cancer and smoking, remember the number two cause is what? Radon. And how many of us are getting detection? And we know that Birmingham has a high concentration of radon in many of our homes. So please, if you don't have radon detection, see the guys back here. And number three, and this is a great segue for our next presentation, is talking about special populations. And in this case, we're talking about veterans and lung health. Our next speaker is, and also I'll point out later on, we're going to have someone else talking about stigma associated with smoking. Our next speaker is Ms. Sasha Smith, excuse me, Dr. Sasha Smith. Dr. Smith is a very well-versed individual in lung health and particularly lung cancer in the veterans community. She will address the unique needs of the veteran community, the historical risk factors that they face, and the services that are available to them. Dr. Smith.
Hello, everyone. How are y'all doing today? It is a pleasure to be here to share about veteran health. Do we have any veterans that are here in the audience today? Yes, yes, yes. Thank you all so much for your service. Hold on. Do I need to step up? Okay. All right. Okay. Thank you all so much for your service and the sacrifice and commitment that you made to this country. It does not go unnoticed. So, lung cancer screening amongst the veteran population. Am I going in the right direction? Yes. Okay. All right. So, for the veteran population. So, as we've talked about, lung cancer screening, lung cancer is the number one killer of all cancers. So, you see a lot of pink in October. You also see that from the top of the month to the end of the month, but no one talks about the number one, which happens to be lung cancer. So, according to the American Cancer Society, greater than 200,000 cases every year, about half of those cancers end up in death. Number one, and 90% of that, of course, we've been reiterating, is associated with smoking. Now, we also talk, our other speakers also mentioned what the qualifications are. So amongst our veteran population, it is the same. It's associated with the United States Preventative Service Task Force. So we call it USPSTF. So long acronym. So you have to be 50 to 80 years old, have a 20-pack year smoking history or more, and we'll talk about that. No prior history of lung cancer, and you have to be healthy enough for treatment. So what does that mean about being healthy enough for treatment? That goes to the other section on the other side that says hold off. So if you have any other specific cancers, or if you have any comorbidities, meaning other things that will prevent you from being able to go through surgery, but that can be determined by your physician, then you would be excluded from screening. It doesn't mean that you cannot get the same scan, but just this particular service. So, within the federal system, we have a way to identify those veterans. So, you can come and ask, like, hey, do I qualify for lung cancer screening? But we already have a system in place to be able to identify that age group. So, it flags a group that I just talked about, 50 to 80 years old. It catches current smokers. And then also, if you are on the cusp, let's say that you have an 18-pack year history, we have a system that's going to keep up with that to make sure once you reach that threshold, we can still identify you to bring you in for that screening. So what is a pack year? I believe our physicians touched on that earlier. So there are 20 cigarettes in one pack, and then it goes to the years smoked. So let's say that you smoked one pack a day for 20 years. That multiplication is 20 pack years, and 31, 22, same goes for that. So, breaking the stigma and shame amongst our veterans associated with lung cancer screening. When you went into the service, they gave you your fatigues, they said, let's go, and they gave you a carton of cigarettes. So, a carton of cigarettes is quite a large number. But at that time, no one knew the implications associated with giving you those cigarettes. They were told, hey, they're going to help keep you calm, they're going to help you in combat. And so there was an association of it bringing you some type of relief during that stressful service. So, others shame, it's my own fault. It is not your fault. As we talked about nicotine and how addictive it is, also as addictive as cocaine and heroin, it was specially formalized so you to keep smoking the cigarette. So that's why they put so many in one pack, because they knew the time it would take before you would need nicotine again. Also, the VA offers smoking cessation to all of the veterans. So they have quit programs. They have a clinical pharmacy referral to be able to take you through those quit programs once you feel that you are ready or you're thinking about it, and especially after today. So, for our minority population, for us, we were targeted on purpose to issue these cigarettes. We were told, like I just said, that it would provide relief, it would provide calm, and then also the menthol that was associated for a smoother inhalation, so it wouldn't be as rough on you and your lungs, and it would be more appealing. So it also takes a heavier toll on that, but the physician before spoke about that. So what we want to emphasize here is that the federal system has created a way for you to take back control so that we can undo the harm that was done and offer a way for you to quit and get out. So if you see here, your body starts to heal right away once you put it down. Within the next 20 minutes of you quitting smoking, your heart returns to normal. 12 hours, your oxygen rises and carbon monoxide clears. Within 2 to 3 weeks, you have better circulation and breathing. 1 to 9 months, your coughing eases up. 1 year, your heart disease risk is cut in half. And 5 to 15 years, stroke and cancer is decreased. So with the screening, you're eligible based on the United States Preventive Service Task Force that I just said. But after you have quit more than 15 years, you're no longer eligible because your lungs actually begin to heal themselves when they are no longer exposed to cigarette smoke. Now, that does not mean, like I said earlier, that you cannot still get the same type of scan, which is called a low-dose CT scan that we do, but it just means you won't have to have that annual scan because you are at decreased risk. So, when you decrease your risk of developing cancer as well as decreasing your smoking, you have more time to be with your children, be with your grandchildren. You have more time to explore some of the things that the federal system may offer to you as far as health care is concerned. You can make better decisions associated with clearing the smog that may be associated with that. And you can leave a healthier legacy and teach the next people that you see that you may have been smoking in the car with or they were smoking with you. So there are counseling methods that are available. The federal system provides support, and there is a quit line especially dedicated to veterans that you can call. So if you're starting on a quit journey, they have that line that you can call, and they'll help walk you through those things if you feel that you have to pick up another cigarette again. So early detection is key. What you see here is a low-dose CT machine. And so it's not necessarily like an MRI. And it does not take long. And early stages of disease, early detection decreases your rate of possibility of developing lung cancer. So with the federal system, it is free for all of our veterans who qualify. So I know that cost is associated with some reasons why people don't seek what it is that they need, but it is a free service that's offered. And then also the stigma associated with not liking going to the physician. We want to make sure that we break those stigmas. Of course, there's history associated with why our population may or may not trust physicians or trust something called clinical trials. But there have been things put in place so that we can make sure that everything is followed the way that it needs to so you can get the care that you need to receive. So also we say, well, just pray. Just pray about it. Yes, you can pray. and you can believe as well, but you have to put forth the work and make sure that you're making those steps towards getting a healthier future. So, as I mentioned earlier, we see a lot of pink in October, but the red ribbons that you see down there, Lung Cancer Screening Awareness Month is in October. And so every October, there are programs that are put on within the federal system to bring awareness, to bring screening, and to educate our veterans on how they can better take care of themselves and how we can help take care of you. So, thank you so much for this time here. I appreciate it, and you all have a blessed day.